Hey everyone, welcome back to the FU Cancer podcast. In this episode, we'll be diving into an important topic for cancer patients and caregivers, managing lymphedema. Joining us is Hari Vennelakanti, a highly experienced physical therapist who brings a wealth of knowledge in rehabilitative care. He's worked across a variety of patient care settings, including skilled nursing facilities, outpatient clinics, home health, and acute care. He's also a certified lymphedema and wound specialist, compression specialist, and credentialed clinical instructor, making him an invaluable resource for this conversation. Thanks for listening to the FU Cancer podcast. My name is Christina Rollins. I'm a dietitian, mom, and wife to a pretty awesome cancer survivor. We said FU to cancer nearly 25 years ago and are still going strong. I'm excited to share the FU Cancer movement, where we are a community of survivors, fighters, caregivers, and advocates, connecting our shared experiences, passion, and determination to live a holistic and well-balanced life. Stay tuned, because we've got a lot to talk about. So lymphedema is a condition that many cancer patients face, but it doesn't always get the attention that it deserves. So let's start by understanding what lymphedema is and how it's related to cancer treatments, particularly surgery and radiation therapy.
Sure. So lymphedema is an inflammatory condition caused by an accumulation of the lymphatic fluid in any area of the body. So basically, it kind of contributes to wherever there is a lymph node injury or insult, it can contribute to accumulation of the lymphatic fluid in that area. So for instance, in a breast cancer patient, so when the lymph nodes are taken out from the axillary lymph nodes, then there is chances that the lymphatic fluid can accumulate in the upper extremity. And let's say there are lymph nodes taken out in the pelvic area, then you will find swelling in the legs. And with the head and neck cancers, when the lymph nodes are taken out in the neck area or in the oral cavity, then you can expect some swelling. There's accumulation of the lymphatic fluid in the oral area or in the neck area. So basically, lymphedema is nothing but a disruption of the lymphatic flow or the lymphatic system in the human body because there is a removal of the lymph nodes.
Now, some patients may not realize that they're even at risk for developing lymphedema. So how can a person tell if this is a condition they should be worried about?
So that is a good question. So basically, in patients with its lymphedema can be clinical. So, I mean, it can be like subclinical, or at the same time, it could be visible as well. So the basic, what one has to understand is the risk factors for the lymphedema development. So anytime you have an axillary lymph node taken out because following the breast surgery or mastectomy, then you are at risk for developing lymphedema. Okay. And then anytime you have radiation therapy because of the cancer treatment, then it does cause injury to the lymph nodes, and that could give rise to a lymphedema either right away, or it could come up like several months or several weeks after the radiation therapy is done. Or any chemotherapy. Sometimes chemotherapy does have some adverse effects on the lymph nodes, so that could give rise to some swelling in the affected area, and being any skin changes because of the radiation therapy that can give rise to some lymphedema as well. There are several risk factors that have been reported in the literature. So that's in a nutshell. So basically, one has to understand is anytime there is a removal of the lymph node, you could be at risk for developing lymphedema, or any kind of radiation therapy as well can give rise to lymphedema.
And does lymphedema look the same in all patients, or is the severity of illness different depending on the cancer type or the surgery type?
It is kind of subjective, but as long as you can are able to diagnose it early stages and you are able to treat it in the early stages, the much better. So early treatment and prevention is much better than waiting for the later stages of the disease to progress. So keep it in mind, lymphedema is a chronic progressive disease. So you have to be careful of looking at the symptoms right away when it develops, or reach out to your physician if you feel like anything, symptoms like heaviness in the limb or any skin changes, or if you feel your rings or bracelet are not fitting properly, or if your blouse is not fitting properly, or if you see swelling in the legs or swelling in the area where they have operated. Yes, that would be a good good warrant for you to seek any physician assistance to rule out any lymphedema. And the extensive of the surgery and the extensive of removal of lymph nodes will be also be an indication for you could be developing lymphedema in the right away, or usually the swelling should last for 4 weeks after surgery. If you still have surgery swelling after 4 weeks, then yeah. Um, but the latest research is any kind of edema can give rise to a lymphedema. So that is a continuum of treatment. So if you have swelling, just make sure you're seeking the appropriate physician's advice and seek medical referrals and get the treatment going.
And what are some of the most effective treatment options for lymphedema, specifically thinking about how they can reduce swelling and improve a person's quality of life?
Right. So the gold standard. So as I said earlier, the important thing is to for early prevention and to find out whether you're having lymphedema. But the gold standard for the treatment for lymphedema is a congestive. It's called congestive. Uh, sorry. It's called CDT. It's a congestive decongestion therapy. So basically, it consists of manual lymphatic drainage, some compression garments, proper education and training, and skin care. So those are the four. So lymphedema treatment can comprise of one is decongestion of the limb, and then maintenance. So there are two phases of it. So decongestion of the limb will be like to reduce the volume. Okay, so the lymphatic fluid has accumulated in your arm or the leg. So we want to make sure we bring to its normal condition where there is no fluid, lymphatic fluid in the leg, right? And then once we achieve that goal, then you kind of switch into a maintenance phase where you wear compression garments every day and keep your exercises going, skincare and proper skincare, and in and use of pneumatic devices to keep that lymphatic fluid going so the limb is maintained its normal volume.
What are some common myths or misconceptions about lymphedema that patients or caregivers should be aware of?
The biggest myth is that it can, like, once you get treated, the disease will go away. As I said earlier, it's not like it's a chronic progressive disease. If you don't take care of it right now, it can get worsened. At the same time, if you pass through the decongestion phase, you still have to maintain it. Uh, and then losing weight will reduce the lymphedema. Well, that's the question that has been being researched right now. So there is no proper answer. Yes, the losing weight will help to reduce the edema, but the answer is still we have to wait what the research will show us the answers. And the other important myth is with the exercises. One of the biggest myths is that if you have lymphedema, you can do exercises. That is incorrect. So it is better to do proper exercises if you have lymphedema, and it's much more beneficial if you wear compression garment and do your exercises with the compression garment on. So that way the muscular contraction kind of helps to move that fluid around your body, around the limb.
So, what advice can you share for any caregivers or patients who may be listening as they're learning to live with their lymphedema, and particularly when it does come to navigating their day-to-day lifestyle?
The biggest recommendation or the advice from me will be for the patients will be to early detect the onset of the disease. And if you have any kind of cancer surgery, and you know that they have taken out the lymph nodes, or they have taken a lymph node for biopsy, and you might want to know how many lymph nodes, what kind of lymph nodes were taken out, then it's always better to reach out to your oncologist, where they can put you in contact with any cancer rehab specialist, where they can measure your lymph. Let's say you don't have access to any of this cancer rehab services around your area, then the simple method is have your caregiver measure your arm before you go in for surgery, both arms or legs, starting from finger all the way to the shoulder, and mark it up every 5 centimeters from your wrist. Mark every 5 centimeters, and take a tape measure, simple tape measure, and uh, measure the volume or the distance, right? Take the measurements and write it down in a paper, wherever you can keep it a track of it. And after the surgery, probably perhaps like after 4 weeks or 3 weeks, remeasure it. So you will see the difference. Again, the subjective symptoms are more crucial. Like you will feel your arm to be heavy. Or if you find yourself in the mirror, you will see that one arm is bigger than the other, or your rings are not fitting properly, or your bracelets are not fitting, as I said, the blouses or the socks. You're at difficulty walking. You feel like walking on a rubber, like you have um, balance issues because of the swelling in the leg, um, kind of stuff. So those are the signs that you can come across when you have lymphedema. Again, early detection, talk to your oncologist, and they will be happy to send you a referral to have you put you in contact with the cancer rehab specialist.
Wonderful. Well, thank you so much for sharing your expertise on this important topic. You've given us a lot of great information in a pretty short amount of time. So thank you. And I hope that our listeners gain some insights into lymphedema as well.
Thank you. Thank you, Christina.
And listeners, if you or a loved one are navigating cancer and lymphedema, remember that you're not alone. We've got a wealth of resources and support available. So talk to your healthcare provider, and of course, check out our website at fucancer.health. We've got a library of educational resources curated by cancer care experts just waiting for you. So please check it out. Until next time, I'm Christina Rollins. Thanks for listening.